From the 35th meeting of the APACRS in beautiful Singapore, I'm Josh Young. I'm here with Mun Wai Lee. I'm excited to speak with you about something cool. So we're going to be talking about the ELON EDOF lens, extended depth of focus lens.
That's right.
So let me ask you first of all how this lens works, and then I'm going to be asking you how it differentiates itself from other EDOF lenses.
Sure. So I think, as you know, the presbyopic IOL market now is full of lenses. I think trifocals and EDOF, particularly EDOF lenses, are the trend now. So the ELON, which I must say has no relation to Elon Musk, is actually another EDOF lens that has been a product of Medicontur. And essentially this is a non-diffractive EDOF lens. So it doesn't use your typical diffractive platform. So there aren't any rings on the lens, and the technology is proprietary, but really it uses wavefront linking technology. Essentially the central 2mm has some changes in the curvature of the lens, thereby extending the depth of focus. And you get that without the use of diffractive rings. So essentially you would expect less dysphotopsias, less of the glare and halos with this lens.
So I mean that of course makes sense in a non-diffractive lens. But what has your experience with the lens been? What are you hearing from patients?
Right. So I've started implanting these lenses relatively recently, I think the last few months. And what I'm looking for with the initial evaluation of this lens is really bilateral implantations, because we know that these lenses, or really when we talk about presbyopic IOL correction, the patients need to be binocular to be able to function well. And what I've looked at is a group of patients targeted with the dominant eye for ametropia and the non-dominant eye about 3/4 of diopters of myopia. So we're looking at a mini or micro monovision approach to try and get that reading for the patients. So my experience so far, I've had 6 patients with 12 eyes. Bilateral implantations have been very good. So in the sense that what we're looking for is the patient that really wants to be able to have some freedom from glasses, the active patient that plays golf perhaps and looks at his phone and needs to actually work on the computer as well. And we found that that delivers in that aspect with not bothersome dysphotopsia. I wouldn't say no dysphotopsias, but having said that and asked the patients for it, they do have some dysphotopsias, but they're not bothered by it. So it's been very positive experience so far.
What is the range of focus with the lens typically? Not in the context of monovision, but just for the lens itself. What's the typical range that you get from it?
Well, I think you can get up to probably about 2.5 diopters of
That's
focus.
Quite a bit, yeah.
That's not too bad. I mean, if you talk about similar lenses in the market, how it's different, as mentioned earlier, that it's not a diffractive platform. So we know there are other non-diffractive wavefront type kind of EDOF lenses as well in the market, and they work very similarly, I would say.
So we're blessed in our field with a range of really excellent lens choices. What is your patient selection process for this particular lens? Who's the optimal patient for an ELON EDOF lens?
So I think we are familiar with it's a jungle out there with all the lenses we have. So we really have to find the appropriate lens for the appropriate patient. So the EDOF patient, I would say, would be somebody, of course, coming to me with a desire to be more spectacle independent. So when that is established, then we would need to have a little bit more chair time to find out about their individual needs, their visual needs. And like I mentioned earlier, it would usually be the active patient that does some reading, usually with a phone, with our smartphone, and needs good intermediate because they also work on a computer, or they're a cook, or they play the piano, and they're very active. They need good distant vision because they do drive a lot, or they play golf and things like that. So those are the kind of patients I would look for, where the reading is important but not absolutely essential. They want to have that good intermediate and distance vision because of their active lifestyle. So those were the ones that I would use the EDOF or the ELON EDOF for. Those that require more reading, perhaps they're a lawyer and they need to read a lot of fine script, then I would probably move towards more like a trifocal for that.
So this is a novel product, novel platform for me. If you were speaking to ophthalmologists, as you are, because absolutely every single one watches this, and you want to give a message to them with regard to this lens. What's the message that you would give to ophthalmologists?
Well, I would say first thing, try it, because the advantages of an EDOF lens are many. I think we've mentioned about that already. You know, with much less dysphotopsias compared to the standard diffractive multifocal platforms. And really, because of the way that it's designed as well, it looks very good in the eye, it's stable, and it's preloaded, so it's very easy to implant. And really, it's got not much learning curve using it, and you might be surprised with the good results you may get.
This is really, really great stuff. Mun Wai, I want to thank you very much for bringing this
Thank you for having me.
to us.
Yeah.
It's you know, it's as you say, it's a jungle out there.
Yeah.
But you've what metaphor can I use? You've cleared all the brush for us.
Okay.
And most of all, I want to thank you for the generosity of the time that you've spent with me today.
Thank you very much, Josh. Thank you. Thank you.